Hi, I'm Natalie from ATMS, and welcome to our Practitioner Spotlight. Today, I'm joined by Rebecca. Hello, Rebecca.
Hello, Natalie. Thanks for having me.
Oh, thank you for coming on board today as well and sharing a bit about yourself and your modality. So let's start there. Please introduce yourself and what modality do you cover as well?
Yeah, so I've been a naturopath for over 20 years. As a naturopath, I also include nutrition, herbal medicine, homeopathy, and looking at diet, lifestyle, looking at stress, sleep that we might also be able to support people's health with.
Yeah, it's not just one thing, right? And it sounds like you've got a few modalities under your belt, which is fantastic.
Yeah, and I'm always adding to that as well. Yeah, I also see that there's more than just a physical connection with people's health. So I also like to incorporate things like thought field therapy, or people might know it more commonly known as tapping, even something like NLP. And all of these things can also make significant shifts to people's health.
Yeah, and I think it's so important because you're treating the whole person, you're not just treating one thing of them. And all these therapies and modalities are helping with that as well.
Yeah.
And what do you, I guess, have as a main area of focus in your clinic as well?
So my main focus is on herbal medicine. I love herbal medicine, just the synergy and how that can help work with the body. It's also personalized medicine. It's like putting together a recipe for someone's individual needs rather than relying on a tablet or someone else's products to contain maybe the key ingredients that you need. And it's individualized, so you can't get better prescriptions than that. And when I work with a lot of stress, fatigue, insomnia,
Yeah.
anxiety, hormones, fertility, yeah,
You
I
do a lot.
have a broad range of people that I help.
Yeah, fantastic. And you mentioned a little bit about fertility, and I know we had a bit of a chat quickly coming on here, and you said you do see a lot of fertility as well, patients.
Yeah. So
Yeah.
fertility's always been such an interest of mine. And
Hmm.
we get to look at so much of someone's health, and optimizing a patient's health. Really, the side effect of that is optimizing fertility. You sort of can't have one without the other. And it's a lot more than just here's a multivitamin that you need to be
Yeah.
taking. It's doing some testing, looking at stress, sleep, gut health, let alone hormones and regular ovulation. And also, importantly, not forgetting if there's a male partner, the male factors for fertility. And really, preconception care is something that everyone planning on trying to conceive should know what preconception care is. The more you can put in to that preparation before pregnancy, then the better the outcomes that can also have, whether trying to conceive naturally or with the helping hand of something like IVF.
I think that's so important. As you talked about there, having that partner involved, having male health is such a huge thing. And I think sometimes they maybe say, no, I don't need to, be involved. But yeah, it's 50-50. You've got to be involved. And I see obviously that you do a lot of functional testing to get to maybe some extra root causes, of what's going on with the female and the male too.
Yeah, and you're exactly right. I've had mother-in-laws say to their daughter-in-law, "It can't be my son, dear, it must be you." And when we do get the test results back, it is usually a sperm issue. So to be able to look deeper into someone's testing that they may have already had done with a GP, a specialist,
Mm.
I'm wanting to really dig deep with those test results to firstly look at what testing has been done.
Mm.
And it's not always normal, even if you're sitting within the numbers of what's in the bracket. So I really am investigating to make sure that my patients are in the ideal ranges, which can be very different, and also what testing hasn't been done. There's so many factors quite often overlooked, and I like to incorporate what we call functional testing. The gut health is really big for me. I think anyone coming to see a naturopath probably needs some element of gut support. So to be able to investigate hormones other than in a blood test, maybe saliva or urine is more accurate. I've had to refer patients, even though that they've seen fertility specialists, to get additional testing to discover that I'm glad we did do that testing because we found the reasons for what's getting in your way of conceiving. So that is a game changer for people when they just believe that, well, the person that I do see says that all my results are fine and there's nothing that I can do.
Yeah, it all fits in the normal range. It's okay. Or it's unexplained. That's what also happens a lot. So that's brilliant. It's so good that you get to the root causes, helping, facilitating these people. And it can be such a big emotional journey for them too. And stress can be a part of it. And I know gut, yes, all naturopaths, as you said, go back to the gut health. So thank you so much for sharing all that insight with us today for fertility and for what you do as well. Now, if someone wants to get in touch with you or find you, where can they see you or find you as well? Can you share your website and your location?
Yeah, great. So I work full time as a naturopath. I have a busy week working at 2 clinics. So people can find me at innerreward.com.au and also at melbournenaturalmedicineclinic.com.au.
Excellent. Thank you so much again for joining us today, Rebecca.
Thank you. Thank you, Natalie.